Welcome back to the Ontario Health Connection. My name is Maille Devlin. I am the naturopathic doctor of the group. So this month we're talking all about lymphedema. So we had Bisa Dobson, our registered massage therapist, tell us all about lymphedema in the past video. If you have not seen that, I would suggest going back to watch that video first so you have a good understanding of what lymphedema is. And so I'm talking today about how I would treat this condition as a naturopathic doctor. So in my practice, I talk a lot about inflammation. I see a lot of patients with cardiovascular disease, diabetes, or metabolic syndrome, and inflammation is the root cause for a lot of these issues. Now, lymphedema is an inflammatory condition, and so we often start there with treatment when I see patients in my practice. So for example, in nutrition, we take on an anti-inflammatory diet. We take out highly processed foods, so packaged granola bars and sugary foods and foods that come in a lot of packages that are kind of those grab and go snacks. A lot of those are highly processed and cause inflammation in the body. We also take out inflammatory fats and oils, and we try to add in more fruits and vegetables and anti-inflammatory foods. With nutrition, we also want to decrease the amount of sodium. So we want to reduce salt intake because this can lead to more swelling in the legs, and patients with lymphedema know that we don't want that. So we do a little bit of salt restriction, and taking out those packaged and processed foods helps us with that as well. And then add in more of these anti-inflammatory foods. I love adding in more herbs and spices here too. Things like turmeric and ginger are highly anti-inflammatory, so you can just add those into your diet rather than having to take a supplement. I always talk about movement with my patients, especially anyone who has an inflammatory condition. We want to make sure you're moving regularly for several different reasons, and I will let Dr. Monica talk a little bit more about that piece, but we really want to make sure we have circulation within your legs and your arms and throughout your body. We want to move that lymph as well as blood flow. Exercise is also very anti-inflammatory, so we want to increase exercise. So I do lots of counseling around that. Rather than, sitting with someone and working on the exercise, that would be something I would refer out to one of our other practitioners. I talk about, okay, how can we add this into your day? So we've got the nutrition piece, we have our movement piece. The next piece I talk about is weight loss if needed. So we want to maintain a healthy body fat percentage as well as just overall weight. Excess weight can make lymphedema worse and can make symptoms worse. So what we do is we work on weight loss. We start with, nutrition and movement. If you've been trying to lose weight for a while and you're struggling with that, we then may take a deeper dive into see why you are resistant to weight loss. And we may run some labs, look at things like insulin sensitivity, your glucose levels, hormones, things like that. I also talk about lifestyle, and I know that Bisa had mentioned this as well. We want to make sure that you're also using compression. I always refer over to Bisa because Bisa is the most knowledgeable practitioner I know on lymphedema, and she is awesome for manual therapy. So manual therapy has to be part of the treatment as well. And so I kind of think this as nutrition. We have our movement, we have those lifestyle pieces. I use supplementation sometimes when we're really struggling with the inflammatory piece. So if we run some blood work and you have very high levels of inflammation that we can see from your blood work, we may then use a supplement to help bring down those levels at the beginning of treatment. All right, so there you have it. That's how I usually start with most patients. Again, we tailor it and it's individual for each patient. That's how I would approach lymphedema from the beginning with a patient. And stay tuned for our next practitioner.